If I don't invest in my knowledge, and if I don't invest in my team, and if I don't invest in my practice, I'm going to be stagnant. And in veterinary medicine, the human-animal bond and that the people want their animals around longer, if you don't invest in learning stuff, you're going to become an antique very, very quickly.
Think about your veterinary practice, your clinic, and the equipment you have around. How many things were you absolutely certain were going to pay off the day that you bought them? And yet they largely have, I'm certain.
When you're trying to think about a return on investment, it's there for you. It's not hard to integrate that into doing day-to-day practice. And there's just so many cases where there are little things that you could potentially add on to for client satisfaction, for patient pain relief.
It's also a continuous flow of income because we have chronic care patients. I have OA patients that are coming in on average 1 to 4 times a month, all year round, all the time.
I took the fact of what the cost was and then factored in with the different levels. We have acute and then we have chronic, and just figured out how many acute things we have and how many times we can use it throughout the week. And it just putting it down on simple paper made it simple. I knew I was going to pay it off in a year.
The laser that I've owned for about 3 years has paid for itself. And if that's possible in a solo practice in rural Minnesota, I think it's possible for any practice up and down the road.
It is an investment. I will say that, having done some of the investment side of this. But over time, it pays for itself. And I think your clients will like to have the option, something different.
If you have enough caseload to make a living, you have enough caseload to pay for a therapy laser.
Last year, or the year before, we actually upgraded to the newer version of the companion laser, and we've already paid it off.
I'm not a commercial. I paid it off in a year. Was I rude with my prices? No, because you have to gauge your prices by what your community can handle, and then the value of that and the trust.
You're going to see a bigger bump in your income and client compliance when your patients are feeling better. So don't hold back, take the leap. You will not regret having a companion laser in your hospital.
Our practice has incorporated it into a revenue generator without thinking about it as a revenue generator. We think about it as a standard of care for the best treatment for our pet, and secondarily, it's a revenue generator.
I think the only way you can't get your money back from starting to offer laser therapy is if you just choose not to tell clients you have one.